you everyone for coming. It's an absolute pleasure to introduce Dr. George Evans Owino, who's the Program Manager for Knowledge Generation Dissemination at Africa's Early Childhood Network. George leads this area, and he both leads on initiated studies, and he also is involved in a whole range of collaborative studies on behalf of the African Early Childhood Network. He also provides technical support to the Knowledge Generation Working Group of the African Union. He holds a PhD from the School of Public Health at the University of Bielefeld, Germany, before joining AFCEN, and he also taught both graduates and undergraduates in the Department of Sociology, Gender Development Studies at Kenyatta University in Nairobi, Kenya. It's an absolute pleasure to have George speak to us today. His topic is a very important topic. Sorry, George, do you want to just share your slides just make sure we're up there? And his topic is a very important topic called Reconfiguring Childcare in Kenyan Prisons, an integrated multi-sectoral approach, an area which George is an knowledge expert. So George, welcome, and we look forward to hearing your talk.
Thank you very much, Alan, for the invitation for me to make a presentation in the Child Adolescent Mental Health webinar series. Thank you also to Gema for having worked with me to prepare me for this meeting. It is my great pleasure to make a presentation on the work that we're doing at Africa Early Childhood Network with the prisons. So what I will do is I will give you an overview of the prison system in Kenya and also share with you some study that Africa Early Childhood Network did with the vulnerable populations, including the prisons, and then perhaps share some of the brief findings and areas of collaboration where people could come in to help, and what we are currently doing with the prisons in this regard, and just take you through a process of a policy that we're trying to develop for childcare in prisons, and finalize with a few lessons that we are learning. The prison system began in Kenya when Kenya was still a British East African protectorate around 1902. And currently, the Kenya Prison Service is anchored into Kenyan law through a Prisons Act that was passed initially in 1977, but is being reviewed annually and constitutes the laws of Kenya Cap 90. Now, as we speak, Kenya has about 133 gazetted prisons, which are holding approximately 51,000 inmates. And among these 133 prisons, 42 of them are for women. And these women prisons are holding about 3,000 inmates as we speak, as at October. And the children that are in the prisons, currently we have about 225 children in the prisons. And the law, the Prisons Act, allows women to have children who are below 4 years in prison. These children could accompany their mothers to prison when the mothers are convicted, or perhaps mothers who are expectant deliver while in prison. The Prison Act allows them to keep these children if they so wish, and if there's no alternative care outside the system until they get to the age of 4 years. And as we speak, 10 of these women prisons have got childcare facilities, daycare centers, where children can be taken care of while their mothers are at work within the prison system. So just to say that, you know, childcare, when you talk about childcare within the prison system, it is anchored in certain constitutional and legal provisions within the country. Our constitution provides for the rights of children in its 53rd article, but also the constitution provides for international legal instruments to be recognized as law in Kenya. For example, the Convention on the Rights of the Child and also the African Charter for the Rights and Welfare of Children is also recognized because of that constitutional provision. Now, I just want to tell you about a study that Africa Early Childhood Network did. Africa Early Childhood Network was interested in how children, especially those that are under 3, we realized that children under 3 are not well taken care of within, education systems, because, for example, in Kenya, early childhood education begins at 4 years when children go to pre-primary school, and the 0 to 3 are really a missing group in the provisions of care. So we wanted to find out how are children being taken care of, or what provisions are there for young children in selected vulnerable communities. And these communities we are talking about, we are looking at urban informal settlements. We are looking at settlements that are associated with agricultural commercial farms, but also looking at women's prisons. So the rationale that informed our study is that these initial years, the first 1,000 days, are the most critical period for human growth and development. And children need to be in very safe and stimulating environments during this period. However, this may not be the case in the environments that we have mentioned. In these cases, you find children are left under without supervision. Children are growing up in unsafe and unstimulating environments. Their mothers and caregivers are increasingly being involved in the labor force, as well as increased incarceration of women who are of childbearing age. So we really wanted to find out what is there in these communities to provide for young children, especially with a focus to 0 to 3. This study that we did was designed as a concurrent parallel mixed methods research design to enable us collect both qualitative and quantitative data. And the ones that are put in red, these are the things that we did that are referring to this particular study. So for the prisons, we used the qualitative approach to data collection because of the implications of doing that research at that particular time, but also because we needed to talk to mothers and talk to prisons officials to tell us the situation as it is. The sites of the study, it was a 2-country study, Ethiopia and Kenya. And as I've mentioned, we were targeting 3 main communities: urban informal settlements. We were targeting large commercial agricultural farms, as well as women's prisons. And in Kenya, we selected 1 prison, and in Ethiopia as well, to just give us case studies of how services are being provided for children who accompany their mothers to prison. And so for this particular population, we talked to incarcerated mothers as well as prisons officials. And we did key informant interviews, we conducted semi-structured interviews, as well as we held stakeholder meetings with these populations. Just to let you know that when we collected this data, it was during the height of the pandemic, and so access to the prisons was not possible. Therefore, we had to do virtual interviews with the mothers. The prisons officers organized for their colleagues who could be interviewed, as well as the mothers that could give answers to the questions that we were looking for. Just some findings. We tried to organize the findings in terms of some of the domains of the nurturing care framework. And so in terms of good health, for instance, we found out that women and children have access to good quality healthcare services, comparatively good quality health services in line with our Ministry of Health guidelines. We also found that each of these facilities, the women's prisons, each has a health clinic through which these health services can be provided, and they are staffed with qualified medical professionals, including doctors, clinical officers, and nurses. And in cases where these health facilities are not able to address the health needs of these populations, there's provision for referral to nearby big facilities of the public healthcare system. Now, in terms of adequate nutrition, which is one of the other important elements of the nurturing care framework, we found that women who deliver are given about 1 year to just stay at home or stay away from work with their children, and thus they have opportunity to practice exclusive breastfeeding. And therefore, I think for us, that's a good thing. Children are able to be breastfed exclusively, but also we found that mothers have access to adequate, well, not necessarily adequate, but basic nutrition. And we are saying that this nutrition, based on the findings, may not necessarily be very diverse and sufficiently to provide for the nutrition of breastfeeding mothers. We also found that children have access to, relatively regular meals. They have 3 meals in a day, including snacks. But also we found out that there's need to improve on this kind of nutritional diversity, as well as nutritional meal frequency. So in terms of early learning, we know that children learn best through play. in only 10 out of 42 of our facilities, they are functional daycare centers and nurseries, and therefore children have opportunity to interact with caregivers, play with one another while their parents are at work within the prison systems. However, the prison system is, not a normal system. It's a closed society, and therefore, whatever we take for granted, the freedoms that we have outside here, the flexibility of the outside world is not within the prisons, and therefore children may lack that kind of, spontaneity and freedom of movement that children need. We found, in terms of whether the environment is sufficiently responsive, we found that the fact that mothers are exempt from work after childbirth and they have 1 year within which to take care of their children, this provides opportunity for, nurturing care, really, for responsive caregiving. Mothers can enjoy, interactions with their children. Children and mothers have opportunity to develop these very strong bonds as they interact during this period of leave for the mothers. Similarly, given that this adequate provision of healthcare services, which is meeting the standards of the Ministry of Health, we can then say that, there is a sufficiently responsive environment within the prisons, in spite of all the gaps that I've mentioned and I will mention as we proceed. And also the availability of, daycare centers, though in not all the facilities, but at least in some, in 10 of them, also provides opportunity for responsive caregiving. Well, in terms of safety and security, we can say that the prisons, there's adequate provision for children to be safe and secure while their mothers are out there working. But we find that this environment has got some challenges. One of them is that children are exposed to aggressive and abusive behavior within the prison system, and they could find instances sometimes where their mothers are exposed to humiliating treatment in their presence or as they see. And also the sleeping arrangements may not be as conducive, may not provide the kind of privacy that parents may need and that they may need with their children. So there's some work that needs to be done around this area, but generally in terms of safety and security, of physical safety and security, that one is there. Perhaps the gap is in the psychological aspects of security. This then brings me to talk about some of the opportunities of collaboration and intervention, which enabled us also to find, an entry point to work with the prisons. So we divide this into maybe 3 broad thematic areas. One of them I call services, another one is legal and statutory issues, and the other one is infrastructure. And so with regard to services, in terms of maybe healthcare, adequate nutrition, responsive caregiving, there are gaps, like, for example, the daycare centers that are available are not fully equipped with the playing and learning materials, including toys. The opportunity there is that people or partners, organizations can work with the prisons to help develop, play materials using locally available materials. Then also there's need to support, to augment the services provided, the basic needs, for example, clothing. Children may not have all the kind of clothing that are suitable to the different changing weather patterns across the year while they stay with their mothers in prison. Then I mentioned about nutrition. There's need to improve on the nutrition of both mothers and their children, and also to support with things like, sleeping materials like beds and beddings for mothers and their children. But last but not least, one of the other things we could mention is the idea that there's need for increasing the numbers of qualified childcare workers. For example, we're talking about nutritionists, we're talking about child counselors who can deal with the mental issues of children, as well as those of the mothers. When it comes to legal and statutory issues, the opportunities we found there is that even though I talked about those legal and constitutional provisions for childcare in prisons, we can say that the child needs to be more properly defined within the Children's Act, the children that accompany their mothers in prison. It is not a very recognized population or a group of children within the legal framework. So especially this Children's Act which is under review, does not sufficiently recognize children that accompany their mothers to prison. The other important point that I want to mention, and which gave us an entry point, is the gap that are to do with a policy framework, which would then stipulate the minimum standards for providing childcare in prisons. So there are no guidelines. There's no document that a prisons officer can use to help them know how do you address the needs of children who are below 3 years to accompany their mothers to prison. Beyond the provision in the Prisons Act that a mother can be accompanied by their child to prison, and also that the prison can provide basic needs like food, it doesn't say anything else, and therefore prisons officers that are at loss. So that was a need that was identified and which was picked up. But not just within the prison system, children need to be recognized within the wider justice system. And so there's need to talk about issues to do with talking about the police, the judiciary itself, the courts, talking about the prosecution. When they prosecute mothers with young children, what are the things they need to take into account? In terms of infrastructure, we are talking about gaps in providing fully functional daycare centers. As I mentioned, of the 42 female penal institutions, only 10 already have fully functional daycare centers. And so there's a gap for the remaining 32. And then there's need to provide separate units for expecting and lactating mothers, and not to be put together with all the other mothers. In addition to providing separate rooms for counseling services, you find that there's no adequate space. Counseling requires a lot of privacy, but this is not necessarily there within the prison system. Therefore, I just want to talk about, based on those opportunities for collaboration, I want to talk about what the KPS, the Kenya Prison Service, is doing together with its partners, where also Africa Early Childhood Network comes in. So the first thing is that the study I talked about, once the findings were ready, we organized, a meeting was organized to share these findings with the prisons personnel. And one of the things we did there was to work with the World Health Organization to talk about the importance of the early years, highlighting the science of brain development, the science of those important early years. And this we did once in a 2-day workshop for prisons officers. Also, another thing that the prisons is doing is to help strengthen multi-sectoral collaboration, bringing different agencies of government that have got a childcare mandate. For example, the Ministry of Education, the Ministry of Health, Directorate of Children's Services, as well as civil society organizations and academia, are being brought together to form a strong multi-sectoral team to help childcare provision in prisons. The other issue is where African also will come in, is supporting capacity development for prisons officers, as well as incarcerated mothers, to just tell them about good parenting, so that once they're out, they are able to take care of their children well, but also reaching out to the other judicial officers like magistrates who adjudicate children's matters, and those who are involved with the imprisonment of women. The final thing which I will talk about in more detail is support to policy development through a high-level advocacy and multi-sectoral collaboration. What we did is that after sharing the findings of the study that we did, we engaged with the prisons officials, the high command, to just share the findings. And through that kind of meeting, they identified the need to broaden the dissemination to the wider management of the prisons, bringing together all the 42 officers in charge of women's prisons in the country. And so this workshop was a very useful workshop. The second bullet point, that workshop not only brought together officers in charge of women's prisons, but we also had the top brass of the prisons, the top management, including the Commissioner General of Prisons himself, also brought together government officials, civil society actors, the academia, together to a 2-day workshop where broad discussions were held to just share about childcare in prisons. People who are working with the prison system, organizations that are working there, presenting what they've been able to achieve, some of their successes, some of their challenges, and lessons which they're learning, as well as recommendations of what could be done so that we could improve childcare in prisons. Subsequent to that were 2 breakfast meetings held to really consolidate the discussions at the workshop to take the process to the next level. These discussions in the breakfast meetings yielded a process guided by a technical working group, which met in the months of August and September to come up with a draft policy, which was reviewed by this technical working group early in October. And we were blessed that towards the end of October, the president of Kenya gave a directive to the ministry in charge of security to work with the prisons to develop a policy for childcare in prisons as fast as possible. And so this has given impetus to the work that was being done with regard to developing this policy for childcare in prisons. After the policy had been, reviewed by the technical working group, it was subjected to dialogue with the senior prisons officers, and they gave their feedback on the document. Currently, as we speak, we are having the 3rd draft of the policy document, and this 3rd draft has been shared with the stakeholders, all stakeholders, academia, government, civil society organizations, to provide feedback, to provide input, to strengthen the draft, so that once that is done, then it will be validated in a meeting that is yet to be determined, but I believe it will come up in the next 2 weeks or so, before hopefully we come to the end of the year. We should be having a finalized policy document for childcare in prisons. So really, this is a quick review through what has been going on with regard to having a policy to provide for minimum standards for childcare in prisons. Finally, I want to just talk about 2 things that we have learned as we are walking through this process. One of them is the importance of being able to obtain, buy-in at the very highest levels with the very highest decision makers and policy makers. For this process, behind us is a senior official from the Ministry of Interior by the title of Chief Administrative Secretary, who is very passionate about this policy development process and keeps following up to find out where the process is, as well as the top management of the prisons is involved in this process. They have been briefed and involved at every stage, and the process is going forward with their blessings. The second thing we have learned is the importance of multi-sectoral collaboration, because the needs of young children at that age are provided by different stakeholders, the Ministry of Health, Ministry of Education, Directorate of Children's Services, and other actors. And therefore, it is imperative that everyone is brought on board, both the professionals, the practitioners, the researchers, to bring all their thinking together, so that when a policy is finally developed, we are sure that we have addressed all the gaps that they may come up. Although we may not address everything, but at least it will be a good starting point to ensure that there's a strong policy to guide provision of childcare services in prisons. So in brief, this is what we've been able to do. And I want to thank you very much for listening to me, and I'm glad to answer any questions that you may have. Thank you.
Thanks, George. Absolutely fascinating, and real education for me. Really very, very interesting.